unattractive video. We should remove the straps.
I'm not showing anything else.
You can do this. You guys can do this again. You can take still photos too and label them. But this is the masseter, which is the main mammalian jaw muscle, and it's sitting in this big space here, going from the mandible to the zygomatic arch or the cheekbone. You guys might want to come behind and all stand around. And so when that muscle contracts, it's going to bring the lower jaw closer to the skull and close the jaw. So that's what you're seeing. This big thing here is the masseter. Kind of holding the arm to the head and the neck. We have a couple muscles here. Oh, what happened? Oh yeah, a couple muscles here. This one is going from the sternum to the head, so it's called sternocephalicus, and that's going to serve to turn the head. Okay, if it's homologous to the muscle in our neck. Turn your chin. Just stand. There you go. Okay. Let's see. Who's Matthew? Turn your chin. Okay. This, don't swallow. This bulge right there. Turn your head back. Drop your chin down. No, not that far. Just a little bit. Lift a little higher. Okay, now just turn your head over. Look at Christy.
Say cheese.
What's with you guys?
Turn it more.
Here, look at me. Ready?
Oh yeah, there it is.
Okay, that one.
Nice.
That's what we're looking at. That's the sternocephalicus. It's got a different name in humans, but only for some dumb reasons. This one here is going from the shoulder to the head, and so that one from the arm to the head. So that one, this one that's going like that, is called brachiocephalicus because it goes from the arm to the head. That's also going to potentially, if he's standing on his legs, that can also serve to move his head, or if he's got his head fixed with other neck muscles, it could actually lift his arm, depending. Okay. On this part of the chest, okay, across the front of the chest, you have the pectoralis muscle. That's this number 4 here, and that's going from the sternum over to the humerus, the arm, the brachium. So that's going to bring the arms in. Boom. Okay. This little doohickey right here, this little cute muscle, is running right down the humerus. It's running right down this angle of the humerus, and that's the biceps, just like your biceps.
Bicep brachium.
Okay. Yeah, and so that's gonna see how I'm flexing his elbow with that. See how it gets bulgy when I do that? The muscle itself gets fatter because it's allowed to get shorter. On the back side of the arm, all of this is triceps. 3 heads, 1, 2, 3. This is all triceps on the back of the pig's arm. So he's got fairly puny biceps, but a very big triceps. And that's because when they're walking, they're using their triceps to some degree to do this, kind of push off the ground with, because they're standing on their arms, unlike us. Moving back, so we can move the head. We can chew. We can move the head. We can bring the arm forward or the head down. Okay. We can flex the elbow with the biceps. These triceps muscles are all serving to straighten the elbow, which he would do when walking. So use my biceps to bring my foot down, put my weight on it, and now these big muscles can pull my body to straighten that out. So if we go up to the shoulder, the one that's holding the scapula to the cervical vertebrae, so it's going from here to here, and in us it also extends up like that. Most superficial is the trapezius. Notice that in this pig, it has been cut away from the scapula, so it's a big flap. But that's the trapezius there, okay? This muscle in front that's running across the scapula and heading down to the humerus is the deltoid, okay? This is mislabeled in the book. This muscle here, see this, is the deltoid. It's labeled supraspinatus in the book, but it doesn't make any sense. Your deltoid, pull your shirt sleeve up, please. Jordan, pull your shirt sleeve up. Okay, now lift your arm like this to the side. Okay, this is his deltoid. It should be on top of everything else. So it makes no sense that something down on the scapula is the deltoid. So this is the deltoid right here. Okay, number 7. It's getting floppy as I poke at it. So deltoid, trapezius. This one back here. Woohoo! Got crazy there because I get so excited about this muscle. Is the latissimus dorsi. Okay, so those 3 are holding the arm to the body, basically. one way or
So
another.
the latissimus dorsi, where is
coming-
that on here? Is it going from?
Oh yeah, it's coming from the spines of the vertebrae, and it's coming down to the arm.
Right.
Okay, so it's retracting the arm.
Right.
That's another.
That's what I was trying to figure out when I was trying to figure
Yeah,
out what
it's
it
an
was. I
arm
was like,
retractor.
It's right
Yeah, it's an
here.
arm retractor. So you basically want to think of these in groups, you know, chewing, these two are head waggers, these three are holding the arm to the body and moving the arm with respect to the body. This one and this one are, this one and this one, where are we? These two are flexing the elbow. This is another one that's holding the whole arm to the body, the pectoralis. So you can think of them in functional groups, and it really helps you learn them and connect them to the same muscles, usually with the same exact names on your own bodies. Okay. Coming back here, in the abs, running down the middle and pretty rudimentary in the pig is the rectus femoris. We don't have that pinned yet because it's so puny. Any fibers that are running this way, from the sternum to the pubis, any fibers that are running this way are the rectus femoris, okay? Not very well developed in this pig. Coming in laterally, you have 2 layers of oblique muscles that come from the bottom of the rib cage and are going to the pubis. So they're coming from here and going down to there, kind of just like my fingers. Okay, and the first set of obliques, the direction is like putting your hands in your pockets. The second layer, if I pull this out, you can see there's another layer underneath it. This layer and the fiber direction is different. And underneath those two, there's still a third layer of muscles. And it's this third layer that are the transversus muscles. Those are the deepest. So if we go through that, we're in the abdominal cavity. So 3 layers of muscles in the abdomen, all with different fiber directions. Obliques on the outside, transversus deepest. Okay, and so you can kind of see those 3 layers there. Getting into the legs, the whole front of the thigh is quadriceps, back of the thigh is hamstrings, and up here you're going to have your butt muscles, your gluteus muscles. So the gluteus normally in us has 3 layers, a gluteus maximus, gluteus medius, gluteus minimus. In these guys, it's the medius for a variety of biomechanical reasons. It's the medius that's most robust. So this 13 right here, which is all in here, on the back of the, it's going from the ilium here, okay, down to the leg, right there. That's the gluteus medius. Okay, so big butt muscle. That's their big butt muscle. There's a little loose flap here. That's the, wait, I just put that in the wrong place. Hang on a second, where am I? Oh no, that's right. Okay, there's a loose flap here. That was the minimus, and it got torn up a little bit, but you don't have to know that. It's not on your list. But this one right here is their butt muscle. Okay. Quadriceps are on the front. Quadriceps have 4 heads, 4 parts. You're only responsible for 3 of them. But there's one that goes from this part of the hip all the way down to the knee. Okay? All the rest of them are going from the femur to the knee, from the femur to the knee on either side of the leg. That's this whole wad of thigh you have here. So what I'm saying is one is going straight down the leg to the knee, and the other ones are on either side, joining it. Those, and then there's one that's underneath the straight one. So those 4 are the quadriceps. Okay, and they all work to straighten the knee. Whee! It's like one of those dancing piggies.
I
Okay.
did that a lot when I was trying to figure out which muscle was where. I was like, okay, well, if I move it this way, which
That's
one's moving?
that's the best thing you can do. That is the best thing you can do with the muscles. So to go back to the quadriceps, this one, number 14, running straight down, is rectus femoris here. This is the vastus medialis on the medial side. This is vastus lateralis on the lateral side. And see how they're all converging to come down to the kneecap, which is right there. And they will all straighten the knee. The hamstrings, there's 3 hamstrings. Okay, and they all come off this one spot. If you sit down, whoever's sitting on a chair, if you sit and kind of rock your butt back and forth, you'll feel that there's bone in your butt. Okay, and you're sitting on these protuberances right there. And those protuberances are called ischial tuberosities, and they're big because the hamstrings come off of them. So I can feel this butt bone right here. I'm pinching it right now. And the 3 hamstring muscles all come off that bone right there. and they run down the back of the leg and they split and they attach on either sides of the knee. So if you stick your fingers behind your kneecap,